And for Botticelli, he made very large forehead. This is the personal value. Personal value are always different from one person to another person, because it's a question of history, of habits, of culture, of trend, of period, of history. So we cannot follow this kind of value when we have to treat patients. We have to reach a universal value, some value that we can share with each other. And this is the nature will give us the universal value of proportion. And this is the key point, in fact, the golden ratio, we find it in the nature. So it's a proportion, and the value is around 1.618, but we find it in the nature. And we find it in all what the nature make as beautiful, as harmonization. And it's not you immediately feel a good sensation when you look at this kind of device. So how I use the golden ratio in practice in my office? So I use a kind of compass. I call it harmony compass. It's easy to make. And it's easy to explain and to assess the face with. You just have to take picture of your patient and put it on a screen on your computer and use the compass. So there is two parts of the compass, a small one and a longer one. And the value that you choose at the beginning, it's the value between each eyes, the internal canthus size. Because it's what the brain see immediately. When you see a face, you see this part, exactly this part. So you open your compass between this size, and you can assess and see what the golden ratio give as natural value. I take this, all these pictures, all these photos from Google, and I wrote beautiful natural faces on Google, and this is the result. So it means that it's a big data, Google today. So it means that if we take these faces, we can say that they are natural, quite natural, and we can find in all these kind of faces, even if they are not from the same ethnic, even if they are male or female, the same proportion. And this proportion gives us the natural value, even for men. So if the y between each eye equal 1, here, you can see that for each eye you have 1. For the top of the nose you have 1. For the tail of the nose and the forehead you have 1.618, 1.618 for the mouth, and 1 from the commissure to the oval, and 1.618 for the cheekbone projection. And even on the black people, only the difference is the value as centimeter for the first measure we take. So you can evaluate immediately that we follow only the proportion. And they are all different, but they are all feel like beautiful. If you go to this sample, this is one of my assistants, and she's in the room today. The value between each eyes is not 1. Both eyes are a little bit too near from one to each other. But if we take care about each eyes, it's equal 1. We found 1 for the top of the nose. We found 1 from the commissure to the oval. We found less than 1.618 for the cheekbones. So it gives us the information that if we want to give a cheekbone projection, we can do it and stay natural. Perhaps she can need small enhancement for the cheekbone. As you can see, 1.618, it's a little bit more than what she had actually. For the size of the mouth, it's okay. For the top of the nose, it's okay. For the forehead, it's okay. Normally for women, it's less 1.618. For men, it's 1.618, but for women, it's less than this. For the oral area, I like this measure. So for 1 for the upper lip, since the top of the nose to the stomion, we must reach 1.618 from the upper bone of the lower lips to the culminant point of the chin, to the pogonium. And as we can see, we can assess that probably she needs a small cheekbone improvement. For this part, we cannot do anything else than give some advice as a makeup. For example, use a makeup more clear and try to remove the shadows that she had between the radix. And if you look carefully to the word area, for one as the value to the cupidon arc, she has a 1.618 for each hemi-lips. And for one for the upper lips, she don't have exactly 1.618 for the lower. So we have the opportunity to enhance the lips using also HA and try to reach better harmonization. And for the OG curve, like Frieden said, it's like an egg, and it's absolutely true. We can assess also and evaluate also the contour purity of the oval. And she needs a small cheekbone enhancement, and we have to restore the volume loss that she has around the chin. So it's easy to explain, easy to assess. And the profile is the same. So we found a good convexity for forehead. For female, it's always convex. For male, is more flat. And we assess also the angle, the frontonasal angle. It must be open like this. For the nasolabial angle, it's okay. It's more than 102 to up to 120. For the H angle of all the way, we give us the good information about the position of the chin. She's here more than 10 degrees. The goal is to be between 7 and 15 degrees, and she has around 20-25 degrees. And this shows us that she needs a small chin projection that we're going to do. For the rickets line, rickets admit that at the moment where the both lips are behind the line, it's okay, but the best is to be at 4 mm for the upper lips and 2 mm for the lower. And here we can see that we have the opportunity to enhance the lower lips and give more projection also. So we are going to, not to change really the angle, but just to remove the hole that she had at the radix. We are going to improve the lower part of the lips and the chin. So what can I do? So I follow this precise repair named butterfly concept, because all these repair follow the golden ratio. And we are also trying to use two different kind of filler. I use normally only HA. In the white position, I use a very firm filler, and a soft one in the blue position. I call it butterfly because, as you see, it seems like a butterfly. And this is what we do and what we achieve immediately after the treatment. So it's a natural result. It's not fake result. She seems better. We cannot know exactly what we have done immediately, but we can see the difference. So with the patient, we have the opportunity to assess, just at the beginning of the consultation, but also when she comes back to the control for eventually a touch-up, and we can assess also with the harmony compass that all seems to be at the right position. So the golden ratio is not a very precise value, it's a kind of slider that we can follow and reach to be sure that you will not have a fake result. Some look to the OG curve. She's nice, she's quiet, enough projection for the cheekbone, and the curve is very smooth from the top of the head to the chin, and the oval is good, and the angle also is just open as we try to achieve. We can also assess with the harmony compass the angle, because I use one with graduation, and we can assess that all seems in the right position and follow the natural value that we can find in the nature. Yes, it's finished here. Okay. So, as we can see here, we really just make small injection. I need only 3 syringes, 3 ml, to do all what we do here, and follow the golden ratio. Even on dynamic, as you can see, it's quite respectable, because there is no something wrong as a fake, in animation in dynamic. We follow also the dynamic aspect of the face. The wrong question about the golden ratio is that some can say that the golden ratio give two consensual results. In fact, yes,